Good morning, good afternoon, good evening, depending on where you are in the world. Thank you for joining us on the second of our gender responsive and disability inclusive social protection clinics. My name is Claire McCrum. I work for the UK Foreign Commonwealth Development Office and will be moderating the conversation today. Just a little bit about how the session is going to run. I think in the chat you should have some links to the various different kind of platforms we're going to use. You can ask questions on Slido. I think Patricia is adding the link to Slido for us. I'll bring up that on the screen in a second. It's where we can ask questions. If you see a question that you would particularly like answered, you can like it so we know that there is kind of a range of people interested in that topic. All participants are able to unmute themselves. So if you want to ask a live question, please do feel free to do so. Also, if you want to share your own experience, examples that you have from the countries or institutions you work for, please do. We want this to be kind of as dynamic as possible. We're really lucky to have a great team of experts who are here to kind of to support us and answer some of the questions, but really want to try and get a kind of live peer-to-peer sharing of knowledge as well. All of this will be recorded into a Google Docs where we'll kind of build on the answers that are given, continue the conversation for the rest of the day, and that will be then the kind of record of this session and the one we had this morning. We do have sign language interpretation and the closed caption. For those of you who need to use that, you should be able to see the interpreter and the captions on the screen. So just a very quick introduction to this session. As I say, we've got some great experts on the line ready to answer some of your questions. Alex, Meenakshi, Lara, Amber, Elaine and Rebecca from the UNPRPD, UNICEF, ILO program, and space, social protection approaches to COVID. Lots and lots of different kind of backgrounds and specialism there, and you'll hear from them much more than you'll hear from me for the rest of the session. So I'm now going to bring up the Slido, and if we can all spend a few minutes looking at some of the questions and adding to some of the questions that we've had. Some of these have already come in, some of them from this morning, and some from the gender roundtable that we just had. So you can see we've had some on the additional costs of programming, advice that you'd give to social protection and gender actors, best way of designing programs on GBV. So if you're able to open that Slido link, like I say, please do add your question, like questions that you particularly want to see answered. We are going to prioritize answering those that we didn't answer this morning because the others are in the document, but we will try and get to as many as possible. So I'll just give a few more minutes and then we will get started. I'll go with the more recent ones. Okay, so as I said, please do jump in to share your experience and any other questions that you have live. We will try and manage it with just anyone coming off mute. If we have challenges, we'll try and use the chat a bit more. But for now, if we sort of get going with some questions, I know that particularly Alex was keen to answer one of the ones that we've had, which was also very topical this morning, on the role of disability assessments in kind of rapid response social protection. And the specific question, Alex, is, so in order to provide quick horizontal expansions of existing programs, how do you make comprehensive disability assessments less time consuming?
Thank you, Claire. I think that there is a little bit of paradox in the question. Quick and comprehensive disability assessment doesn't really go together. What we know now is, based on the experience of countries like Fiji or Vietnam, is there are ways to do fairly comprehensive assessment in a way that is quite easy, simple, and can be delivered and implemented at community level. I think one of the key elements is that it's kind of challenging to do that on a national scale, starting from scratch in the middle of a crisis, because you would have to develop the tool, you would have to train people. Actually, the simple tool requires some training with social worker and community worker. It's feasible, but it's a certain investment. Another thing that we can do, and it's an important difference we did this morning, is basically identifying household who are people that are likely to be disabled, and that's what you do when you use, for instance, the Washington Group short set or an set of questions. And that's the difference between identifying household with person with disabilities and making individual disability assessment, which is a different task and require more time. But as I mentioned, a few years ago, it was more difficult to answer this because we didn't have example of countries which in their national social protection system have used non-medical based assessment carried out at local level, and it's done now. So I think that there is a base to be able to say, yes, we can do better. But if you really want to quickly spread and expand, one of the things that we have seen with example this morning from Indonesia, also this afternoon in the roundtable with Kenya, is actually the connection between local government and organization of persons with disabilities, which kind of skip the comprehensive disability assessment to focus on identification, on quick identification within few months to be able to expand scheme. One interesting practice though, for instance, if we cumulate that with the example of Brazil, which basically granted access to the benefit pending assessment, basically giving the benefit of the doubt to claimant because of the awareness of the time it takes to carry out the disability assessment. So I think the combination of those different approach, a community level simple assessment, connection with DPOs and local government for quick identification, and using the disability assessment more as a verification rather than a precondition, can allow fairly safe and rigorous expansion fairly fast. Thank you.
Great, thanks very much, Alex. I think we're going to go from the sort of the details of disability assessments and enrollment to sort of a much broader policy question. And this again came up quite a lot in the Gender Roundtable recently. A question about women making up a great deal of informal workers who aren't in contributory schemes but have really suffered during the COVID pandemic. And a question that has been posed is, how do we reimagine systems to better protect the rights of women as well as formalise their employment and contribution to society, including using active labour market policies? So it's much broader about the role we see for social protection and the opportunity in terms of reimagining the system. So I'm wondering, Bex, do you want to kind of give an initial response to that and then I'll open up in case any others have contributions?
Sure, thanks. And I think this is something which, COVID has really highlighted in terms of identifying the gaps in existing social protection programs, but also the gaps in terms of the bigger system. And I think more than anything, really, the pandemic has really shone a light on, what we sometimes call the missing middle. So those population groups who tend to fall out of your typical or perhaps mainstream social protection schemes, such as those who are unable to work, those who would be eligible to receive child grants, for example, or pensions. But the pandemic has really focused on the working poor and especially informal workers. And we know that the majority of sort of informal work, or a lot of informal work, falls especially to women also people with disability who are often, you know, in the lowest paid types of informal work, with limited social protection, social security options. So, you know, that's really sort of highlighted the need for those broader systems to cover a majority of the population across their life course, including obviously including informal workers. And I think, you know, this is also just highlighting the need for linkages between social assistance and social insurance as well. Sorry, and I'm just going back to look at the exact question that was posed. How do we reimagine systems to better protect the rights? Yeah, so I think, you know, reimagining systems which are much more comprehensive in terms of addressing both the needs for recipients of social assistance, but also in terms of expanding social insurance schemes as well to informal workers. And we have seen you know, cases of this, for example, both in Brazil and in South Africa, where there have been responses even prior to COVID, but perhaps also ramped up in response to COVID, especially where domestic workers are covered by social insurance. So I think this much more comprehensive approach and the thinking about the role of both social assistance and social insurance is really important going forward. Happy to also hear other people's views on this as well. Thanks, Claire.
Can I jump in with just a...
Go for it, Laura.
Sorry, Amber. I was just going to say that I think that when we're conceptualizing informal work, I think we can, in this context particularly, look at it as all gendered, absolutely. But I think that there is informal work that is done sort of regularly as part of the economy. But I think there's also a lot of informal work being taken up right now in the absence of other livelihood options, or, you know, the precarious nature of employment. And I think on the gendered side of this, the things that I'm particularly interested in are the women that are involved in care and social work, care and domestic work. And then I would say also the one that I'm particularly interested in is women engaging in sex work. And I think that we shouldn't just see that as a reaction to the crisis, but there were a number of sex workers engaged in that work prior to the crisis that are still going to be involved, that are not going to be covered by any social protection scheme that I know of, and are also, there's an element of illegality to the work that they are doing that prevents them from accessing those for social protection and cash schemes. And then I would say the other part of that I think we also need to layer on top of looking at informal work is migration and immigration status, and whether or not, again, there is a sort of legal status that would permit people to be accessing any kind of social protection scheme that was brought in response to COVID. And I think that, you know, taking the sort of intersectional approach to looking at informal work is really useful when we start designing programs to respond to it. I'll stop there because I'm interested to hear what Amber has to say.
So just to add on, I wanted to note that, I mean, in terms of thinking of social protection as a right and kind of reimagining how we go forward, obviously COVID is, you know, an unfortunate, let's say, opportunity to do this. We know from past research, especially on the politics of social protection, that crises are kind of a pivotal point for change in the systems. And there's a great book on the politics of social protection by Sam Hickey and colleagues that actually kind of narrates some of these changes over time in countries in response to crises. But just to go back, I guess, to the gender component, actually Rebecca and colleagues have done a nice piece of work on the politics of gender responsive social protection, and I'll put that link in the chat, but basically, I mean, there is a lot of advocacy that can go on right now in championing gender responsive social protection, both at the regional and national level, to build a coalition of actors that really can frame social protection as going beyond seeing women as just mothers and carers, and the instead as recipients on their own right, kind of these different support systems. So I think now is also the time to be thinking about building those coalitions and championing kind of on the political side, so that we don't kind of lose the political will that's being built during COVID-19 to roll out and provide social protection in the future. I'll stop there.
Thanks, everyone. I think, Alex, did you want to come back specifically on this? And then I think there's a follow-up question that links very nicely to Amber's point.
Yeah, just very briefly, I think one of the things that we are really advocating for is universal disability allowance that would be compatible with work. And one of the big arguments for that is that men and women with disabilities who very often, to be able to access social protection, needs to be certified incapable of working, and which means that if they take up work, formal and informal, they will lose benefit, and they do not get coverage for the disability related costs they face while taking up work, and it's specifically relevant in countries where they're very high informal economy. So we really believe that adoption of universal disability allowance that would be compatible with work, like in Vietnam, Fiji, Thailand, Mauritius, Georgia, are really tools that can help women with disability and men with disabilities to find their way in the informal economy and getting the support they need to find and keep jobs. Thank you.
Thanks, Alex. One of the questions that we've had, which links to a point that I think Amber just made on coalitions of actors, was a question that came up in the side of the Gender Roundtable and in this Slido as well, is to what extent are social protection actors advocating for a conceptualization of social protection that includes care and care work and the revaluing of care work, and it particularly kind of those institutions and individuals that are advocating for cash plus approaches. Do we think there is enough in terms of linkages to care work going on? So sorry, Amber, I'm going to put that back to you since you mentioned the politics question.
So yeah, this is a really good question. I mean, we know that I saw kind of another question around, you know, is there potential for social protection to increase care work? And I think we know from a lot of the early programs in Latin America that this is definitely a potential where women are made responsible for complying with conditionalities, whether it be taking kids to the health clinic, ensuring they're attending school, or attending trainings. And obviously we want to mitigate this potential and make sure that we aren't placing additional burden on women, definitely within the programs that are actually supposed to kind of support them in various dimensions, including time poverty. I definitely don't think that we're there yet. We don't kind of have a good way of making sure that we're not doing that across different program designs. Of course, during the pandemic, we definitely have been advocating for dropping these conditions and dropping other kind of barriers that might be there, such as recertification of benefits or other hoops they have to jump through to register. And so this is very promising during the pandemic, but kind of in general operating or after the pandemic, it's not clear that there is enough attention to care. It's not clear that obviously programs aren't being designed with care kind of as a front and center. So whether or not there's enough advocacy for it and the social protection actors just aren't willing to take it on as an additional factor because of politics, or whether this kind of just isn't on the agenda is not clear. We see some kind of promising practices of, for example, in public work programs, having creches or childcare being provided, but definitely we need to go beyond that. And I'd be interested to hear what others think are promising practices in this area. Over to you.
Great, thanks, Amber. I think that does lead us neatly onto a question that we've had about the design of public works. But before we go on to that, I just want to pause for a second to see if any of the participants at all in the meeting or any of the other experts want to come in on any of those questions, or to share additional experience, or to ask a question directly. So I'll just pause for a second to see if there's anyone.
Find out I do I don't get that give you an order. Man, come make and show you for station on a laptop. I don't like some.
Sorry, I didn't get. I think someone was coming in to ask a question there, but I couldn't make out what that was. Okay, if there's no questions or anyone else wanted to come in, I think we can go on to that nice segue. So the question I can get up on the screen here was, sorry, give me 1 second. Some governments have opted for public works responses. Are you aware of cases where these have had a gender intentional design, for example, by hiring women to provide social care and support service or health services? So obviously, Amber spoke a little bit there about a few examples of creches and childcare provision, but is there anyone who would want to kind of come in and talk a little bit more about gender and public works?
I don't have a good example. So all I'm going to say, though, is to pick up on, I think what Amber was just saying, is that we also need to ensure we're not gendering our public works programming by specifically targeting women, for instance, for care work. I think, we need to look at what the public works program is going to offer and make sure that it is accessible and barrier free for both men and women, and not just pigeonhole women into work that they would traditionally seem to be doing. Of course, if that's their choice, there's no problem with that. But I think we shouldn't presuppose that the work that they should be doing is care and domestic work.
Yeah, I agree with that, Lara, and I'll just come in briefly as well, just picking up on some of those points on public works. I think it is important to be thinking about the type of work, and I think that also the type of work which is often produced from public works programs, but I think that really also comes in and highlights the importance of community discussions, poverty and vulnerability analyses, which take into consideration the diversity of communities that men and women face. I think we have seen some, I don't specifically know in the context of COVID, but I know previous to that we have started seeing some sort of flexibility within public works programs. For example, in Rwanda, there's an expanded public works program which has tried to address some of the constraints that women face to participating in public works. So not only thinking about offering the provision of childcare services as a public works component as part of the work, but also thinking more broadly around the flexibility of hours. So giving women in particular, but also carers of people with disability, the flexibility in terms of the hours that they work, Also in terms of the how far they have to travel, so trying to keep people a bit closer in the work that they have to do. So thinking a bit more broadly, and of course, you know, some of the other key issues within public works are not only the type of work conducted, but also the provision of equal wages as well. So I think there's a whole sort of issue around sort of the whole process of design and implementation that needs to be considered from a gender perspective. And I think, you know, just in terms of valuing, you know, care work and thinking more broadly around that, just linking up to what Amber was saying earlier, I think there's also an increasing emphasis on you know, cash plus activities, for example, that are linking national cash transfer programs, for example, in Nepal, to additional complementary programs which are supporting parenting sort of skills, for example, and importantly as well, including both men and women, both mothers and fathers in that. And I think that's a really important point to be thinking about, as well as we think about care services, and not just, you know, relegating that to it being a woman's responsibility, but thinking more broadly about encouraging family-friendly policies and engaging men as well as women in care activities as well. Thank you.
Great, thanks, Bex. And I see that Valentina has posted in the chat a link to a review that was done just immediately before COVID, a literature review on gender-sensitive public works, which really adds to that answer as well. Again, just to reiterate, if anyone else, any of the participants do want to share any of their experience or come in with a question, you're welcome to at any point. But I was going to go to one of our popular questions that I think was posted this morning, but I think there's definitely potential to expand on the answer that was given then to a new audience as well. I was going to ask Elaine, so a question that's been asked is, what delivers better results, targeting women and people with disabilities or making sure they are included in other programs? What are the different costs and benefits? I'm wondering if you wanted to come in on that.
Hi. Yeah, I mean, I think if we're talking about inclusive approaches, one of the ways forward has always been to think at the time of design, how will this affect an impact on women? How will this affect an impact on persons with disabilities? And then even beyond that, how will it impact or have an effect on their dependents or other people in the household? So, I mean, again, it's all about context, it's all about local resources, but I mean, we were talking earlier on about this issue of identification, assessment and targeting of persons with disabilities. And one of the big discussions that's been going on over the last few months is that, you know, when comprehensive household surveys are being undertaken, they should all be featuring some disability specific questions. And if those can be comparative across countries, even better. I don't think that's the case at the moment. So it would seem to me that the best way forward is to make sure that we are thinking about both at the time of design, but there are also going to be circumstances where you will want to be specific in terms of your identification and targeting, where a specific need has been noted amongst the population. And I mean, for example, just recently Sierra Leone, where aiming very, very hard to be inclusive in terms of their disability programming or inclusion. And in their social protection schemes, they discovered that their proxy means test was actually excluding people because of the way it was designed. So you have to bear it in mind when you are designing any program, and then look to find ways to be more inclusive if you discover that you're not capturing those groups within the programs that you're designing. There will be some more in the Google Doc in terms of the direction towards specific documents that people can look at and refer to. Alex may want to add something.
Oh, thank you, Ellen. I think you really highlight the key issues. What is really important for us is to have an overview of the social protection system and to see within this social protection system what are the schemes, mainstream schemes, that are the best place to actually provide support to persons with disabilities, and what are the remaining gaps with regards to disability specific needs. And we have often these questions, and the balance actually is specific to to each social protection systems, because different schemes can provide different type of support. The extent to which you can make a mainstream scheme inclusive may be limited by circumstances. So I think you were highlighting a very important element, which is really trying to anticipate how best you can make a scheme inclusive, and looking at the overall system, trying to identify where do you need a specific scheme to address specific requirements of person with disability, for instance, and where making inclusive a mainstream scheme would go a long way. And I think it's really about having a system approach. Thank you.
And just one very quick follow-up, because it came up in an earlier discussion, was this whole idea of, you know, the intersectionality of people's needs and social protection programming. So, you know, it's not one or another, and it's not necessarily just, I mean, disability, as we know, is complex, and you know, one of the examples that was brought up was the fact that older people particularly are more likely to experience or have a disability in the general population, no matter what country you live in. Older women with disabilities, if we look at sub-Saharan Africa, are more likely to be caring for children because of the HIV pandemic, even pre-COVID. So, you know, we have age, disability, caring responsibilities, women, all of those kinds of issues wrapped up in one package. So I think it's trying to consider how these all cut across each other when thinking about both needs and targeting.
And maybe just one more element which we encounter very often is the fact that in some countries, actually many, schemes are mutually exclusive. You were referring to older person, for instance. Many older person who access, for instance, old age pension, and they have a disability, especially, for instance, women with disability with care responsibilities. Why wouldn't they be able to accumulate the old age pension and the disability allowance to address the disability cost and other issue they face? And I think it's important for the social protection systems not to think always that having two schemes is double dipping. Sometimes it's just two schemes addressing two different issues, and not being that should not be mutually exclusive, but they should complement each other to address those intersectionalities.
Thanks.
Can I just, sorry, I keep on just adding on to others, but there's so much great stuff that people are saying. But one thing I think that links actually to one of the other questions we've got on Slido here is that in the absence of analysis and data and information, then we have to do really crude targeting. And I think that, you know, it just draws attention to the point of why we need analysis, particularly gender analysis, to understand the gender roles and the gender norms and the gender inequalities in a context, to be able to design our programs to target those who truly are the most vulnerable. But that is predicated on the existence of that data and in the existence of that information. And oftentimes it does exist. It's not necessarily the best that we would like to see, but we should be accessing and utilizing existing data. But we also know in many instances that data is not collected and it's not analyzed and it's not perhaps made public. And so I think the question of targeting is an uncomfortable one sometimes, because we don't want to just assume that there are certain members of our population that are inherently vulnerable by their very existence. But when we're responding, particularly when we're responding in a crisis, we do need to use those crude measures to determine who we should be targeting. But I guess the point I'm really trying to make is it just brings us back to that question around, well, we need to fully understand the context where we're operating, and we need to understand these different dynamics and how they are interacting. I think both Alex and Elaine gave really good examples of that. And, you know, to do that, I think it's an investment to maybe bring on specialist support who can just be looking at that and can monitor perhaps changes in gender participation in the workforce, for instance, or things like that throughout the duration of a project or program, so that things can also be amended and changed and adapted as we go. I don't think I'm nearly as eloquent as the previous two speakers, but I guess I just wanted to bring that up, that this also links to the importance of why we need the analysis before designing a project, but then also to monitor it as we implement it.
Laura, I would jump on that as well, just to say it is quite promising, I think, that not only kind of more data is being collected rapidly, but I think we're seeing a precedent where researchers and organizations are actually making their data public quicker and available to use because of the importance of data in the crisis. So I hope that, you know, this will continue to some extent, and that these sorts of indicators that will allow the disaggregation and the analysis of gender and inclusion aspects to be done will continue. A plug to everyone out there collecting data.
Thanks, Amber and Lara and Elaine and Alex, for that kind of really useful discussion there on targeting. I was going to ask one of the additional questions on targeting on rural urban, but I feel like we've maybe covered that, I think, quite comprehensively in terms of the issue of the need to have data and the need to have better data. But I was going to then move on to, we've got a kind of a different string of questions that are not so much focused on kind of the targeting and the assessment. And one of those, which I mean could be about targeting or vulnerability, it's very broad at the minute. I was going to come to Lara. There's a question just on what can we learn from the humanitarian sector? Trying to find the exact wording now. But yeah, so what can social protection actors, be that look at kind of gender response, disability inclusion, what can we learn from the humanitarian sector in terms of a COVID response?
I think, I mean, one thing, and I have to sort of preface with this by saying that the area of humanitarian response that I've worked in most often or for the longest is on gender-based violence. And so I might kick off with those points, and there might be others, particularly from the disability side, to add. But anyways, I think one of the big lessons we can learn is that it's been a long fought and hard won battle to have gender-based violence be considered as a life-saving measure, and also to have it just be considered to be happening everywhere. So in absence of any reports or any formal data, we should just be assuming it's happening, and we should be mitigating the risks of it happening in any kind of sector programming. And I think that that's something that we can draw from the humanitarian sector, particularly right now as we're responding to COVID. Interestingly, this is the first crisis I've seen where the attention to gender-based violence is as high as it is. And I think that's, I say I welcome it. I don't welcome the phenomenon, but I welcome the fact that we're actually considering this within the wider response globally to COVID. I think another thing that we can learn from the humanitarian sector is again, particularly that has come out of the Grand Bargain, out of the World Humanitarian Summit, is that providing cash is more respectful of the dignity of the recipients. And I think that we've seen in the humanitarian sector, as I mentioned, through the Grand Bargain and the World Humanitarian Summit, but more just that there's just been a real groundswell of calls for localization. So, sorry, I just got a fly in my nose. That we got more localization and recognition of local actors, and that they are truly the first responders to emergencies. and also the accountability to affected populations. And that's sort of humanitarian jargon for essentially our accountability should be to the end recipients and not necessarily only to donors, not necessarily only to the organizations that have sort of skin in the game in terms of what their expertise or specialties are. I think the other thing that we can draw from the humanitarian sector in COVID is just the great challenge that coordination presents, and bringing together so many organizations, individuals, actors to have a comprehensive response. And I think that gets really challenging when you start looking at, you've got, national level governments, and you've also got community leaders, and you've got everybody in between, and bringing all of that together, and the amount of data that generates, but not necessarily is compiled and collected and collated in a way that is useful. I think that there's, again, I'll say a lot of work that's been done on information management in the humanitarian sector, and we can draw from that. More specifically, on a response to GBV, we know that, again, it's been deemed life-saving in humanitarian responses, but that to truly respond to that, we do need a multi-sector approach. And so, that includes cash or social protection as an element of it. And I think we should be looking at social protection as a response to these issues, but also as something that can prevent these issues, or these situations from coming to the fore. So, and then I think the last point I'll make is just that we also recognize, whether or not we've taken appropriate action is another question, but we recognize the harm that can be done through the delivery of humanitarian aid. And I think whenever you've got power differentials with a lack of accountability, which is often the case in a humanitarian context, you have the opportunity for exploitation and abuse. And I think particularly of concern to me working in the gender-based violence field is the opportunity for sexual exploitation and abuse. I want to point out here that cash and social protection are not inherently more risky. We don't have any evidence that says that they're more likely to create these opportunities. I just think, though, it's something that we always need to be keeping in mind, that this exists, and we need to do what we can to safeguard recipients from experiencing that level of exploitation and abuse. And that is, I think, the duty of care really is on the sort of goes down from a donor, but also I think right down to the implementing partners. And that's where I think we all have more work to do, but I would say, and it's possibly because there's been some pretty high profile scandals in recent years, that the humanitarian sector has been at least talking about it. I think we still need a lot more action to be taken.
Great, thanks, Lara. And I see three excellent resources have been put in the chat there. So one, a great blog by Amber and Lara on the intersections between social protection and gender-based violence, and then the overall space, gender and inclusion, and disability-focused sections of the resource guide that Valentina and Space have been collating, and also the link to linking humanitarian assistance and social protection. And I was just wondering, Elaine or anyone else, whether you wanted to come in and say anything particularly about what we can learn from the humanitarian sector in terms of disability inclusion, if there are lessons, or not lessons, but is there something particularly that you can think of from the disability side?
I would say that the lesson has always been, and I think it came up in an earlier question around resourcing, in extreme circumstances where resources are limited, people tend to exclude rather than include right from the get-go and the outset. So in the humanitarian sector, there is more and more and more inclusive practices from the beginning, but again, a lot of what happens is down to resourcing and targeting, and for people saying it's not actually necessary or important for us to target this particular subset or this particular group at the moment. And I think this is the danger of categorical targeting when we look at it in that sense. So I'd just say urging caution when we look at that, and try and, as I said some time ago, you know, when you're doing your design, think about how you can make sure that the programs are not harming or damaging or excluding any particular group.
On my side, I think one of the thing that social protection can learn from humanitarian action is, I think, really about the outreach, about especially the work that has been done through clusters and with some disability and the NGOs together with organization of persons with disabilities, which, how do you reach out to the persons who need the support? And too often the social protection system is basically waiting for people to join. And with all the barriers that exist for persons with disabilities to access, which are very often heightened for women with disabilities. And I think this whole idea of collaboration, engagement with organization of persons with disabilities to actually reach out to people who may need the support, I think it is something that is sometimes done better, surprisingly, because it's done in a crisis situation or post-disaster, is done in a better way. I think also there is a lot of work going on DRR, disability risk reduction and preparedness, and how do we make that inclusive? And I can see some strong convergence in that regard, for instance, with regards to national disability registries, where actually you have DRR actors who wants to have those kind of database to know, okay, where are persons with disabilities in case of disaster? For instance, in the Pacific, there is a lot of questions around that. How do we have those data before the crisis or the disaster strikes so that we can react faster? And actually, when you look at the information they want for their database, it looks a lot like what you would need in a national disability registry. So I think there are those elements of convergence. A point of caution, though, is that the type of instrument that are used in humanitarian cash transfer, for instance, have very specific purpose. It's about survival, it's about, while social protection overall, from a national system point of view, should not be geared only towards that. It should basically embrace the idea of support to participation and inclusion. Thank you.
Thanks, Alex. And just to very briefly add to that, for those of you who may have been at the Gender Roundtable, we had, I think, two really great examples. One from South Africa on this kind of issue of databases and how in COVID response, they were able to use a variety of different databases that hadn't been used for social protection to reach out to new or non-traditional caseloads, and hearing from the kind of the ministry there about, you know, the next step, the challenge being, you know, how do you make that more systematic? How do you ensure the linkages to services and the kind of the layering of the different services that people need is continued post-COVID when some of the emergency responses have ended? And how do you kind of really build on that to have a more comprehensive and more shock responsive system? And then also an example from India in the kind of the partnership with grassroots activists, with some women's rights organizations, with frontline workers who were able to really kind of identify the people most at need and link those to government services, link to community mobilization, and really kind of the power of those kind of particularly, I think, women who are, you know, care workers, who are teachers, who are health workers, and have that access and that knowledge, and how you kind of empower them and bring those in to kind of the delivery of a more comprehensive social protection system. Sorry, I'm waffling and being reminded that I've got 10 minutes left.
Oh, geez. Can I just, I feel like I'd be remiss if I didn't say this, because I've mentioned it, and I think some of the others have mentioned it as well, is that we're really calling for integration of gender and disability into social protection. And I think, you know, I've said it myself that, you know, engaging with disabled persons organizations or engaging with women's rights organizations. But from the humanitarian sector, we know that those are the sectors or the types of organizations that get the least amount of money. So we also need to be really mindful that as a social protection actor, we aren't being extractive and expecting those organizations to help us design and implement our programs without compensating them in some way or ensuring that their budgets are fully funded for them to be able to do that, because we don't want to be seen to be taking away from the work, the meaningful and important work that they're doing on advocacy and service provision to those populations, to help us, you know, improve our programming. And so I think it's just maybe as Alex says, a bit of a word of caution too, that we know there's been analysis in recent years on humanitarian financing that shows that these are the organizations that tend to get the least. So I think you know, that's a call for more funding of those organizations and core funding so that they can continue to offer this service, as it were, to other sectors, but also that if the social protection sector has the budget, that they could perhaps be you know, I'm probably using the wrong term, but subcontracting or, you know, paying for that service and that information and that knowledge that's coming from these organizations.
Great, Lara. I think excellent points, and I think really important, as you say, that it's a partnership and it's an empowering and well-resourced partnership, not extractive. Mindful of time, I am going to finish with a question to everyone that has come up on advice across sectors, but I think just there have been a number of GBV questions, so I'm going to very quickly go to Amber to ask, can you respond to, I think, our top liked question, which is how can social protection be designed to have the best chance of preventing GBV? Just give a very large question, if you can answer that very quickly, and then we'll wrap up.
Sure. Well, I mean, yeah, this is a very large question, and I think we, in the recent blog that was put on the chat, we go into a few different examples, but I think it depends on your level of ambition. So there are some small design tweaks that could be made within a kind of typical cash transfer program that could enhance the protective effect of cash. And we know that, for example, many programs that have looked at this in rigorous evaluations have found that cash alone can prevent or reduce some forms of GBV, including intimate partner violence. And these are primarily through income channels, so reducing poverty-related stress in the household, improving mental health, as well as potentially empowering women through her receiving the cash specifically. So while we don't have a lot of evaluations that actually try to isolate these design features, we do think that if the program is sufficiently tackling poverty over a long period of time, and if the program is sufficiently placing more resources in the hands of women, this is promising. Of course, there's a lot more you can do, and one thing that has been proposed and has been tried in several settings are complementary programming, so Cash Plus. Now we have some ideas of what might help in this area, including best practices and what works to prevent violence, such as tackling harmful social norms and working on improving relationships between partners. However, we don't have a lot of research that actually tells us that that there are synergies between programming. So, for example, we don't know that it is more cost effective to implement these programs together rather than separately, and that's something that we need more of. But we do think that there is promise in bringing kind of these two sectors together, as Laura said, and we hope that there's more kind of research on this and more innovation in implementation in the future. During COVID-19, I would just say that what we are advocating for is kind of low-hanging fruit, which is things like linking actors to GBV services and helplines, giving information at touch points, and really integrating a GBV prevention response into the grievance mechanisms that are already available through sort of standard cash transfer programming. So there's a lot more to do, but that's a quick answer. I'll turn it back to you, Claire.
Great, thanks, Amber. And just to flag, so Valentina has put in the chat as well, all of these Slido questions will be kind of answered, but also there'll be an ongoing discussion around them on the link to the Google Docs there. Please feel free to add in, bring your own examples, share experience, ask further questions. We'll keep an eye on that and make sure that's all responded to before the end of the conference. And Patricia has sent around the survey to just give us some feedback on this session. But very quickly before we close, I think there's been a really interesting question, which is, if there was one piece of advice you would give to social protection actors from a gender perspective, what would it be? And the other way round, one piece of advice to gender actors from the social protection perspective. I'm going to expand this to be gender and disability actors and ask each of our experts in 30 seconds. You can choose one way or the other to give us what their one piece of advice would be, and then that will be the end of the session. So thank you all very much for joining us. I can't actually see anyone because I've lost my screen, but I'm going to start with Bex because she's top on my screen, and I'll go around from there.
Great, thanks. Well, okay, I'll have to narrow it down, but I always have quite a few things. But I think for me, okay, so from sort of a social protection actor, from a gender perspective, sorry, to social protection actors, I think it's you know, not for us as social protection actors, not to just think that targeting and coverage of women is addressing gender equality and inclusion. So, you know, I think we need to think beyond that. We need to be really understanding the context and the needs of people and addressing them through social protection programming. That doesn't mean building extremely complex programs, but it does mean honing in and addressing the needs from a gender and inclusion perspective. I'll leave it there.
Great, thank you. And then next on my screen, we've got Amber, followed by Alex.
Okay, I'm going to make mine really simple, and that's just that everything, you know, these are all things that interact in our lives. So I would say to gender actors, poverty and social safety nets really matter. They matter for your outcomes, and they matter for the lives of women and men and families. And for the gender and for the social protection actors, I would say, again, the opposite. So gender really matters. They matter to your programming success, and they matter to the lives of the people you're affecting. So basically, do your homework, realize that all these aspects interact, and you need to be addressing them in your programming if you want to be successful.
Yeah, on our side, I would say engage. Today, you have organization of persons with disability, and I really appreciate what has been said before about financing them, but you have organization of persons with disabilities that are stronger and more skilled and more aware and ready to engage in making social protection more inclusive. And I think it's very important for social protection actors to engage, because social protection actors do not always really understand disability, and persons with disability organizations do not always understand the complexity of social protection system. And sometimes there is two dialogue that don't really make one. So I think engaging is really important, and understanding that social protection is essential to support inclusion of persons with disabilities. Of course, accessibility is important. Of course, overall inclusive policies are important, but it will take time. And in low and middle income countries, a little bit more than elsewhere. So social protection has a critical role to play to support persons with disabilities across the life cycle. So engaging with organizations to know how to best do that in the most cost-effective way and the most universal way is really important. Thank you.
Great, thanks. And hoping that Patricia will give us one extra minute. Can I go Lara, Elaine, and then Meenakshi?
Yeah, really quickly, I think I'm going to focus my piece of advice to the gender-based violence sector, and just that I think my one message would be that cash and social protection is not something to be feared. I think it is, we should start considering it more as another tool in our toolbox to both prevent and respond to violence that is gendered. And then in the reverse, very simply, that to social protection actors from the gender side is that gender does not equal women and girls, that it is, you know, a complex sort of social phenomenon that is you know, we all have a gender, and that it is not something that we should just be relegated to the experts to be thinking about and considering.
Thank you, Lara. And to reiterate what has come up a number of times in the discussion already, policy acknowledgement, or acknowledgement amongst designers, that although lower income is usually captured by needs assessment, the higher costs that people have due to a disability or not. And when you're thinking about social protection programs, think about that. Thanks.
Great, thank you. Meenakshi, do you have any final thoughts to social protection actors or gender?
No, I agree with yeah, I agree with Alex, but I would also look at data disaggregation and look at relook at the existing policies to effectively reframe them to include the responsiveness towards persons with disabilities, and also look into involvement at the impact assessment also. The method of impact assessment should be really responsive and inclusive of persons with disabilities. But I agree with Alex and the policy aspect.
Great. Well, thank you all so much for joining us. Thank you for asking the questions. As I said, please check out the Google Doc. There'll be more engagement there. A huge thank you to all of our experts who have answered these questions and kind of have been available and will continue to be available to respond to further ones that come in. So I hope you enjoy the rest of the session and the next few days. It's been great to take part in these clinics, and thank you all very much, and apologies for running over.
Thank you.